My name is Jag Batra. I'm one of the pediatric infectious disease doctors here at Miller Children's Hospital, part of the Bickerstaff Pediatric Family Center. I've been here since 2006 and have been taking care of children and young adults with HIV for the past 12 years, since 2003. I've been taking care of Ken since about 2006 as well. 3 million people are actually diagnosed with HIV in the U.S. But probably about 15% don't know that they actually have a diagnosis. About 85% actually are diagnosed or know of their diagnosis. Of those, about 40% are actually in care of some type.
Oh, wow.
Okay? Of those, most of those that are in care have been prescribed some medication. Okay? Of the total that you have, of the ones that are diagnosed, 85% that have a diagnosis that have already been made, established, 30% are virally suppressed.
So I fall in the 30%.
That's correct. So you have 70% of the people who have HIV in the U.S., living with HIV in the U.S., do not have a do not have a suppressed viral load. That means they are not undetectable.
Okay. And so what does undetected mean?
Okay, so undetectable means, so there are different ranges of how much virus there is in the blood. Essentially, undetectable means that there is not a detectable amount of virus in your bloodstream. And there are different machines, depending on the machine you use, you can either have less than 40 copies, so when copies are the amount of virus per milliliter of blood. So the machine comes back with 100, what that means is 100 copies of the virus per milliliter of your blood. Most machines nowadays report values at less than 20, and usually if it's below 16, many machines, that's kind of their threshold. That means that it's not detectable. So if you're below that level of 16, it'll say, many will report it out as not detected, which doesn't mean that there can't be 1 or 2 copies, or it's maybe something there, but it's below the level of detection. There's some machines that may use that are used in research that actually can go down to 1 copy, as low as 1 copy per ml.
So,
but undetectable means you have essentially not detected in the blood, or at a level that's beyond the machine's capability of finding it.
Okay, I've always wanted this. So, like, let's say I go to a different hospital that's never seen me, never heard of me, and I go there and I get a blood test.
Correct.
Would they be able to diagnose HIV in my system at all?
If they're looking for it specifically, or so you're asking, the question is, if you go to a different hospital and they don't know you have HIV, they can send tests off that are going to be looking for the HIV, or looking for HIV. They would not be sending the tests that we're talking about right now up front, because that test takes at least a full day to run, but many times by the time they send it, it's usually 2 to 3 days before it comes back. What they will test you is for the antibody. So most people, not everybody, but most people who have had HIV or have HIV will have an antibody to that virus in their bloodstream, and that antibody generally stays positive lifelong. There are some people who have had HIV for many years and have been treated for many years, and actually when we test for their antibody, it actually is negative. So that does happen as well. But the newer testing that we have can pick up a recent infection as well. So to the most part, yes, if you go to a different hospital, if they send off the right test, it should be still positive.
Okay, so, and then also with being undetected, how, because this has always been a worry for me, is having kids. So is there a chance of me having kids without affecting my wife?
Right, so there are different ways of doing that. So there are methods that people use if you, there's sperm washing techniques, there are different techniques that can be used. There are expensive, but that's one of the things that has been looked at. There are other ways that you can potentially conceive children by your viral load being undetectable. Your wife or your partner can take medication to prevent the infection and still become pregnant.
Okay.
So those are different ways of doing that. There's no guarantee that you may not get infected, but certainly the risk of transmission from you being undetectable to any of your partners, even if you don't use a condom, the risk of transmission is significantly less, but not zero. So the recommendation is never not to use a condom. Obviously, in a situation where if you're trying to conceive children, that's a separate issue. But generally speaking, even with a low or undetectable viral load, our recommendation is always to still use condoms, because not just for HIV, it's protection against other diseases as well.
What is HIV?
Okay, so HIV is a virus, human immunodeficiency virus. It's a virus that's contracted in various methods, sexually by needle injection use, could be splattered into any of the mucous membranes, depending on how much virus there is in that blood. So it's a virus that hits part of your immune system, specifically your T cells. It's called your CD4 cells. And T cells are important in your body to help control infections from different viruses, bacteria, fungus. So your immune system is really at risk if this virus goes and basically gets rid of all these CD4 cells that are in your body.
Okay. And
I was
going to ask, so what's the difference between HIV and AIDS?
Okay, so HIV, so someone who has AIDS has HIV. So HIV simply refers to someone who is infected with the virus.
Okay.
AIDS is a separate part of having HIV. It's a separate, if you want to call, when your immune system is at a different level or a very low level. That's based on certain guidelines we use. For example, when your T cells that I mentioned, CD4 cells, are less than 200, as an example, then that person is defined as having AIDS. And there are many other definitions. There are different categories of infections, specific infections that one may get that classify you as having AIDS. So certain specific infections, if you have those, typically they go hand in hand with your immune system being low. But if you have a specific infection like TB, then with HIV you would be classified as having AIDS.
Okay, so you can go from HIV to AIDS. Can you go from AIDS to HIV? Can you lower that?
Well, you can certainly. So AIDS, as I said, it just refers to kind of the progression typically in someone who has not been treated. But if we're strictly using the numbers, then someone who has fallen below 200 and is classified technically as having AIDS can certainly bring that number back up.
Okay.
So now whether you classify them as AIDS, technically once someone is classified as AIDS, you tend to keep that classification, but it doesn't necessarily mean that that person's immune system isn't back up to a much better level beyond the initial AIDS definition.
Okay.
So I think the AIDS classification is, there's more of a stigma attached to it in a way that people say you're classified as AIDS. It simply means that your immune system has fallen to a point where you have more serious illness, or your system is at a heightened level that you may you're at a much higher risk for other infections.
I'm really glad you said stigma, because that's people ask me why now, and I believe it's because kind of didn't care about the stigma anymore. And why do you think there's such a bad stigma around HIV and AIDS?
Well, I think there's been a lot. The part of it has to do with misinformation. Education regarding HIV has not. I think a lot of people have tried, but I think there's still a lack of education about HIV, generally speaking. And the fact that it's a disease that is maybe considered that you've done something wrong. That's why you have it. Different populations that are at higher risk. So I think it also relates to people's judgment or morality about what you've been doing, and whether you you did it to yourself and stuff like that. So I think instead of realizing it's a disease that anyone can actually get, people seem to be at judgment about how the person may have actually acquired it, rather than dealing with the person and what we can do to get the person better. Certainly having someone who is infected and having HIV and the virus puts other people at risk if there is any, let's say someone has a cut and there's some mixing, that other person who may be exposed to that blood is at risk. So I think there's fear along with that stigma. I think fear also carries that stigma along as well.
I think that's the only thing that carries it.
And miseducation.
Yeah,
or
miseducation.
lack of education about what it means. People, about. I talk to families. Within families, people are shunned and are not sharing utensils, are not eating with the family, and that's very unfortunate. It's just a matter of helping the families understand that it's not transmitted in that way.
Yeah, and it's funny you said that, because a person I recently met was, we shared a drink, and she was like, I can't believe I'm sharing a drink with somebody who's HIV positive. But I guess with them getting to know me and really seeing that I'm a regular human, there's nothing wrong with me. She was more comfortable with me sharing a drink with me and sharing utensils, and it's the message. How can I educate people better? That's something I would love to know, because this is the reason why I'm doing this whole thing.
Right.
It's because after I stopped saying stigma, I didn't care about it anymore. But I'm to the point where I remember how I felt. I felt alone. So I want everyone else to really feel like they're not alone, and not to be scared of the stigma, because I was never scared of the disease. I've never been scared of the disease after I was educated about it.
Yeah, I think reaching out to people, and obviously, it's a very private decision to allow other people to know of your diagnosis, and a big part of that is the fear of how people are going to react. So I think you have to allow people to get to that point to a certain extent. How can you help? I think it's a matter of getting, as you say, getting the word out there, that it's not a death sentence. I think HIV care has come a long, long way in where we were 20 years ago to where we are now. And I think that's the message that needs to go out there, and to help people understand that, number one, get tested. If you aren't tested, you'll never know you have it. And if you do have it, then there are many ways to support you through the initially finding out about the diagnosis, educating you, and making you healthy. And essentially, anyone with HIV, with a new HIV diagnosis at this point, has the same life expectancy as anyone who does not.
Now, like recently, Charlie Sheen actually came out yesterday and said that he was HIV positive, and I realized he was taking 4 pills, and I take 1 pill. Does my lifestyle, being a healthier person, play a factor in that? Does being healthier really help like your side effects and all that?
Right, I think your overall health certainly helps any chronic illness that you have. So I think if you can maintain all your other, keep your other illnesses at bay, you're going to be healthier overall, and your immune system is going to be stronger. So I would agree that if you can stay healthy in all aspects of your life, eat well, exercise, that would certainly help, not just in your case, but in anyone who has any chronic illness. In
the pills, like
in the
how?
pill, yeah, I did see the interview, and when he said 4 pills, I'm not sure if he was actually. I'm not sure if he meant 4 medications, honestly, or if he actually meant 4 pills. Now he could be on 4 pills because it's possible his virus may have resistance, and that's why he's on additional medications. But typically, most medications that we start patients on at this point can be either 1 pill or 2 pills or 3 pills a day. 4 pills is not something that would at least be considered first-line treatment that I can think of at this point. It could be that they have to add additional medication at some point, maybe because he developed resistance or something like that. I'm not sure. Or he may have misspoken and meant 4 medications. There was 1 tablet that has 4 medications in one, so I'm not sure if he meant 4 medications and he said
just 1 pill, okay.
Right, so I couldn't, but I was thinking about that exactly, because it appeared that he said that he's been undetectable for a long time, and
He's taking 4
typically
pills.
that when you start and have done well, you shouldn't develop resistance, so I'm not sure.